Hi, my name is Holly Edwards. I'm currently completing my practical observation of medical nursing routines. This is the video evidence. In today's procedure, we'll be doing a dental on a feline. Now, I have chosen to do oxygen therapy and intravenous fluid therapy in today's procedure. The reason for the oxygen therapy is that the cat actually suffers from asthma, so we want to pre-oxygenate before the procedure. During the procedure, obviously, she will be hooked up to the oxygen machine, and post-surgery we want to keep her on oxygen for at least 10 to 15 minutes after the procedure has been completed. I will also be showing you how I insert a catheter and how I connect the patient up to intravenous fluid therapy. The feline is an 8-year-old female cat, domestic short hair. Her name is Smudge. She weighs about 8.5 kilos. She is severely overweight, which we have spoken to the client about previously today already. We have recommended the Hills metabolic food for it to lose some weight. The healthy weight for the cat would be trying to get it down to about 5 kilos. To clean the equipment that was used today in the dental procedure, I will be wiping over with disinfectant and using a sponge to clean. Majority of the dental kit can be submerged in water, so I left that for about 10 minutes in water with warm water and Chlorhex to get rid of some of the dried blood. I then scrubbed it and let it out to dry. More of the sensitive dental equipment are the dental heads for our dental machine and the ultrasonic scaler. So these I didn't submerge in water. I sprayed over with disinfectant and then wiped them down with a paper towel. I did this twice just because these heads do tend to get dirty, so I did do that cleaning procedure. So this is the result of me cleaning up after today's procedure. I have cleaned all of these utensils here in the sink. They've now been left off to dry. The masks that we used today for Smudge's procedure plus some others, I have also washed them, submerged them in water, and now have left them out to dry. The clippers that we used are also done, and also the thermometer that I used during monitoring Smudge's procedure, that has also been cleaned. Patient records. We keep all the records, the consent form, and also the dental chart, all stapled together. This all stays stapled together just so if we are ever in need of looking back at this paperwork, his procedure is all together in one. During the course of Smudge's procedure today, there wasn't an opportunity for me to give any oral medications to her. It asked for 4 of them: electrolytes, paste, drenches, or medications. The only drug that was used throughout the procedure today on Smudge was lignocaine, so local anesthetic injected into the gum line when Dr. Bethany was doing her surgical extractions. I'm not allowed to be injecting lignocaine into the gum line, so I wasn't able to film myself. Here I am setting up a fluid bag to be connected to Smudge. I've collected everything needed for catheterization and his IV in a dish. Here we are pre-oxygenating Smudge. Because she has asthma, Dr. Beth recommended that we do 5 to 10 minutes of pre-oxygenation before we induce her into anaesthetic. So here I'm currently wrapping her in a towel where we're going to apply a mask over her muzzle, which will flush some oxygen into her. Because she's quite a smoochy cat, she didn't put up too much of a fight around having the mask over her face. Towards the end, she was getting a little bit irritated, so I just left the rebreathing system as close to her nose as I possibly could. This is where I'll be inserting her IV catheter. Dr. Beth will be supervising me once I do enter the needle. Here I'm just clipping away her fur, getting in preparation for the catheter to be inserted. To sterilise her skin, I wiped over the clipped area with a cotton bud with methylated spirits. Once the catheter was in, we decided to give her some more oxygen, so we applied the mask back to her face. Here I'm connecting her catheter to the fluid line. I then turned on the pump and set it to 23 mils per hour. Here you can see me clipping her nails. I clipped her front ones quite far down as they were really long and hooking over. Her back ones didn't need too much done, so I just clipped the top off. Because Smadge's teeth were quite rotten, Dr. Beth wanted to give an injection of antibiotics, so here I have given a subcut injection of Clabulox. Okay, so just to confirm for the dental chart, we're extracting 204. And which one on that side?
I just realised now this. I don't think I need to extract any others, but do you mind bringing up the upper?
Yep. Upper left side?
Yeah.
There's upper left. That's what's labelled as. I don't know if you've changed the labels there or not.
No, that's fine. This is upper left. That's right. The other teeth look okay. Yep.
Okay.
Yeah, they look fine.
Alright. Here I've started to clean off Smadge's face. She had a little bit of blood on her cheeks and under her chin, so I'm just using a swab with some warm water to clean off the blood. Here we're giving some post-operative oxygen therapy. I've applied the mask to her face and we are going to oxygenate her for the next 5 to 10 minutes while she's in recovery. Here I am giving her an injection of anti-inflammatory pain relief called Medicam. This is going subcutaneously.